On this episode of Mom Sipping Sangria.
So there's the winter blues of feeling low, but once we get into seasonal affective disorder, which is called SAD, that's when you have symptoms that are very similar to depression.
I'm good. Let's do it.
Well, hello there. Welcome to another episode of Mom Sipping Sangria. I'm Sheila Walsh.
And I'm Anita Reynolds MacArthur. And today we are enjoying some delicious Happy Place Sangria, Sheila, made with ginger ale and pineapple and lemon and, a little bit of Merlot.
Just a little bit. It's pretty tasty, Anita. And more than this putting me in my happy place, you know what is really bringing me to a happy place this month is when we get the little bursts of sunshine. It's so dark and it's so cloudy. And, you know, the last week or so, we have seen a little bit of sunshine in like weeks, it seems like, right? So I don't know. I find that sunshine really elevates the mood, just changes the vibe. Do you find that too?
Totally. The lack of sunshine actually drives me berserk. I think I might get that from my dad. My dad was very much like that, or still is. But I notice as the years go on, I get worse, and the kids really notice it with me too. That too cloudy for too long. I'm just going to be in a bad mood.
Do you remember we went to Jamaica? And hopefully you remember that.
I do remember parts of it, anyways.
And it was like I remember it really bothered you because it was raining the whole time, and we were only there for like 4 days.
See, I don't even remember that now.
Yeah, I don't care. I'm not cooking. I'm enjoying this, but I remember it really bothered you, and I thought, I wonder if you suffer from SAD or winter blues.
Interesting.
Do you suffer from winter blues?
I do feel that I do to a certain extent. I don't know if I would call it SAD in particular, but definitely like the cloudier, the longer those days go on, the worse my mood gets, or the more somber I get as well. Yeah,
and I think I do too. I don't think I get the seasonal affective disorder SAD, but this time of the year, a few months into the winter, and it's like, enough already. It is enough already. And I like to try to get away at this time of the year in February. This time last year, I was actually in London, England with my friend Kim. And in London right now, it's like spring, right? 14 degrees. It was not every day, but it was sunny. It was flowers blooming. And we're kind of far away from that.
Yeah, we're still a ways away, unfortunately. In Canada or parts of the States, chances are you are right in the trenches of midwinter, and you may or may not be, like me, experiencing the winter blues or the winter blahs. Well, we have a guest joining us today. Love her, as she has some amazing tips to help us get through this time of ickiness in the year. Let's say hello to Dr. Onye Nnorom.
Thank you for having me.
Hi, Dr. Nnorom. Thanks for joining us on Mom Sipping Sangria. First of all, the drink, sangria, to beat the winter blahs. What do you think? I'm just kidding. So first of all, can you give us an overview of what seasonal sadness or SAD means exactly?
Yeah, so some people call it the winter blues or blahs, or call it kind of seasonal sadness. But whatever you decide to call it, it's really that around this time, like many of us just start to feel our mood sinking, right? Particularly tired or sluggish, and it's really due to the fact that we have longer days that are darker, right? So the days are darker, there's less sunlight, and so that takes a toll on many people. And in more severe cases, it can present as a full clinical condition called seasonal affective disorder. Newer term that doctors are using, or depressive disorder with seasonal pattern. So that would be a more extreme case where people are, really crying a lot, really experiencing symptoms of depression. But that's a little bit less common. For about, let's say, 15%, so the numbers are about 15% of Canadians will experience mild symptoms like the winter blues, and only about 2 to 6% will experience more serious conditions like seasonal affective disorder.
So how does someone know when they need to be seeking help from a physician?
So, it's certainly a continuum. I don't think that there's just this particular exact point where I would say to start to speak to your physician. I think you have to engage in that kind of self-care and self-awareness, or, listening to those around you and saying, you're not quite yourself lately. But really what we look for when it comes to seasonal affective disorder from a clinical standpoint is, patients might come in talking about feeling very sad, irritable, They might be crying frequently, like really tired, like much more tired, not just low energy, but tired, difficulty concentrating, and also in social situations kind of wanting to isolate themselves or craving carbohydrates or sugars, which I know kind of we all sometimes crave. Of course, we crave those carbs and sugars over the winter, but when it's in that kind of storm of symptoms, and we know that perhaps if it happens to a person this winter and then happens again next winter with, these darker days, then we will make the diagnosis of seasonal affective disorder. So if you feel like that describes some of what you're going through, even if it's not all of it, and you can't function as well, then that's the time to speak to your healthcare provider, your family physician, your nurse practitioner, and for somebody to kind of guide you through that.
Okay, so it sounds like you're looking for a pattern, and that's when you act on it. So you gave us numbers: 15% of Canadians, and I think 2% actually have the SAD. 15% feel the mild sadness. Why does the lack of sunlight and maybe not getting outdoors affect some and not others?
Well, yes. So I think just as like with any changes in life, like whether it's about sunlight or it's about, a new job or it's about, kids or anything like that, there's a lot of different things that happen in our lives that we just know different people have different reactions to. Right? Where one thing might cause one person to feel a little bit low and might predispose another person to a full depression or having anxiety. It really depends on the person and their context and their genetics and a number of different factors. But overall, if we're going to talk about like the impact of having, less sunlight in the day, then a lot of the science that has been done on this is like looking at the fact that for a lot of people, they'll have reduced amount of the neurotransmitter serotonin. So that's related to mood and depression, producing more melatonin, which is involved in like sleep and lethargy because there's less sunlight, and also less vitamin D. So definitely can't say exactly why one person will have it and one won't, but can certainly see why for a lot of people it might kind of affect their mood, and for some people really extremely affect their mood.
So you just mentioned vitamin D, and in the winter, I definitely up my vitamin D. Am I helping myself by doing that? Is that something people should be doing? Is that what you recommend?
I mean, certainly one wants to have good vitamin D levels, but when it comes to seasonal affective disorder itself, there aren't clear findings on the benefit of high dose vitamin D. There have been some studies investigating the association, saying that taking very high dose, so like 100,000 international units daily, can improve their symptoms. Keeping in mind that like most pills are like 1,000 international units.
I was just going to say that's
100,000. Yeah, right, high doses. So most of the treatment for seasonal affective disorder, some of the frontline treatments are either antidepressant medication, with some vitamin D. Counseling has been shown to be effective, and then certainly light therapy. So not just any light, but again, you'd want to speak to your physician about this, but using bright artificial light, particularly in the morning, has consistently shown promise with regards to seasonal affective disorder. In fact, in Scandinavian countries, they have like light rooms where the light is like indirect and evenly distributed, so those are available to people. So depending on where you are, you might have an access to a light room, but light therapy has been shown to have some good effect, but certainly antidepressants and counseling have also been shown to help.
Oh, okay.
So in terms of you mentioned the artificial light, this is a store-bought, I guess. Like where do we get artificial light if you're living here?
Yeah, so if you're living here, that's why I said you should certainly speak to your physician, because then you would want to find out about the different types of lights available for light therapy. They have to be certified. I know some people kind of just buy like whatever's online, but in fact you would want to have the right type of artificial light that mimics sunlight. Now, if you don't have seasonal affective disorder, then certainly just trying to make sure that you pay attention to getting enough sunlight can be quite helpful. So you might not be at the point where you need artificial light therapy, right? When we're talking about the winter blues, then really just making an effort to get that sunlight, open, the windows, go outside or sit by the window at work, try to get as much bright light as you can, because it's outside and it's free. You don't want to try to do that first. think the certified light really comes in when you have a diagnosis of seasonal affective disorder. Like you really are in the more extreme case in that 2 to 6% of the population.
Okay. So now I know that you have, there's an acronym BRITE, BRITE, to help, beat the winter blues or winter blahs. Can you go over that with us?
Yeah, so that's an acronym that I just developed with my patients because actually in a lot of the clinics where I've worked, I've also seen the winter blues in newcomers to Canada as well. So I've worked in clinics with a large number of immigrants, and so coming to, once you live in more northern countries, that's where you have these shorter days, right? So I developed that to kind of help my patients adjust to a bit of the winter darkness that causes that winter blues. So that's where I came up with the acronym BRITE. So it's BRITE. So the B stands for brightness. So kind of like what we talked about. Again, if you're having mild symptoms, then you just want to make sure that your environment is sunnier and brighter, either going outside, opening up the windows, sitting by the window, at lunch. The R stands for relaxation, and it's not helpful when people just tell you relax, right? Everybody knows that. Nobody relaxes when somebody says relax. Nope. But really thinking about what are techniques that work. So yoga, meditation, Tai Chi, but in particular meditation, because there's so many apps out there. There's so much opportunity to take free mindfulness courses, but that has been shown once you're in that practice, it's kind of like riding a bike. You have to do it a few times, but can certainly help with anxiety, depression, and winter blues. The I is for intake. So thinking about food, what you're taking into your body. And so there's, quite a bit of evidence around trying to have a diet that is much more plant-based. So it doesn't have to be entirely plant-based, but thinking about the Mediterranean diet or the Japanese diet, where really half the plate is vegetables, right? So thinking about what you're taking in, but definitely trying to stay away from too many carbs and sugary complex carbohydrates. And then the T stands for talk. So talk to a friend, connect, let trusted people know how you're feeling, because you might think that maybe it's just a little bit of blues, but somebody around you might say, you know what, I think you're just not yourself. Something's changed. Maybe go see your doctor or go see, your nurse practitioner. So you do not want to isolate yourself. There's so much research now in public health showing that loneliness is actually causing a lot of health problems in and of itself. So you definitely don't want to isolate yourself. And then the E is for exercise. And I know that word sometimes can be oh my gosh, exercise, so I'm not talking about a Jane Fonda moment or something. I'm talking about
thank you.
Really just be active, right? So find what works for you. I always say, personally, I have friends who love to run. It gives them endorphins. I think that's awesome. But I personally do not run unless I'm chasing something like the bus or something's chasing
or your
me,
kids.
Right?
Yeah.
Or my kids. Yeah. So literally I don't run, but I love to dance. I found what works for me. So it's really about staying active because that's been shown to improve mental health and even, depression. So that's what BRITE is. It's, BRITE, brightness, relaxation, intake, talk, and exercise.
Excellent. It's so easy to remember too, and that's something that we should all certainly practice always, but certainly over the dark months. I just want to jump back when you were talking about new Canadians. I didn't really think about that, but if you're from a country that is 35 degrees year round, and you go to the North countries, if you're not used to this is probably going to really impact, just your psyche for at least that first year until you're used to it.
Yes, absolutely. Actually, interestingly, seasonal affective disorder was discovered by I believe he was a South African physician, but he was an immigrant to the United States. And he was just I am not myself. What is going on when winter came? And then noticed this pattern in other people. But I think other people had just kind of, gotten used to it or just, noticed being sluggish. But he was a physician. He was just this is odd. And he was seeing it in patients. And so started to do that research. And then it became an official recognized disorder in medicine. But yes, absolutely. It's a struggle when people first come here.
For sure. And I'm glad that discovery was made, because a lot of people need this kind of direction. So before we know it, here, the snow will melt and the flowers will be in bloom and we'll be all right again. But for now, you can't hibernate. So use Dr. Nnorom's BRITE.
Absolutely. So thank you so much, Dr. Nnorom, for taking this time to chat with us today. We're going to post the BRITE, BRITE tips on our Mom Sipping Sangria social media outlets. Where can we follow you?
Probably the best place is Twitter. So my Twitter handle is at Onye Active MD. So at ONYE Active MD.
Excellent. Well, we will post that too. Thank you, Dr. Nnorom, for your time today.
Thank you so much.
Thank you so much for having me.
We'll talk to you soon. So before we get to our hot topic, we just closed our first giveaway, Anita.
Oh my gosh, it was so much fun, and our followers were so awesome. So a shout out to everybody for joining in the fun. The contest ended February 13th at 11 p.m. and we chose our winner on February 14th. Please be sure to check out our story. You may have won 2 tickets to see Hamilton on March 21st, 2020. So if you have won, you have until February 16th at around noon to DM us, or we will have to select another winner.
Right, and that makes sense because we have to
Yeah.
we have to make sure that person knows they're going to Hamilton.
Oh my
I'm so
gosh.
stoked about seeing that. It's
Oh
going
my
to be
goodness.
amazing.
Yeah.
So Anita, last episode we introduced something new, and we thought, oh my God, we can make this regular because we have a lot of stuff to vent about.
Don't we?
Something you want to vent about this week, Miss Anita?
I do, Sheila, actually. As your days go along, there's so many things you can vent about. So this one was a pretty easy one. It was just kind of hit me in the face. I'm like, yeah, I'm going to talk about this. So I'm very careful when I meet people for the first time, get to know their name, how they spell their name. And I kind of expect the same from people, but of course, not everybody is the same. And so I just started a new freelance gig, and I'm going to be working closely with this person named Lindsay. And so in my years working with people, you're writing a lot of emails, you're texting, you're this, that, the other. And so I've come across Lindsay, Lindsay, and then I've come across Lindsey. And now the latest one, I'm like, oh my gosh, no, there's a third Lindsay. And it's Lyndsay, Lyn. So I've not encountered an Lyn before, so I had to really drill that into my head when I'm emailing her for the first time. We're getting to know each other. I don't want to upset her by, using the wrong name. And she made a point of telling me it was an Lyn. So I'm like, oh, okay, got that. So, got that first email going and getting the communication. And I'm like, yes, okay, nailed it. I got Lyndsay. Hit send and wait a little bit. And I get a response and I read the response. I get down to the bottom and she says, wonderful. Thank you, Andrea. Steam just came right out.
Is her name Steve Carell from The Office?
I must have been practicing Lyndsay for I can't tell you how long, and with just a little wonderful thank you, Andrea, when my name is Anita. I'm like, are you kidding me? Did
you follow up and say anything?
I totally ignored it. I just ignored it. I mean, what are you going to do, right?
Yeah, that's a tough one because it's just etiquette, right? And it's just taking the time. I wonder if she feels bad about it or if she even notices.
Who knows if she even knows? I'm sure she noticed at some point because my response was all caps. No, I'm kidding. I didn't do that
I might just play along and continue to call yourself Andrea. See if maybe she gets it wrong and calls you Anita after all. That is funny. Well, you know what? If anybody out there has something they want to vent about, or an idea for a vent, because I think we could literally go through our day and say, my purse getting caught on the door coming outside. There's a 1 in a million chance of that happening or something random happening. Why can't the 1 in a million be a lottery win or just drivers or whatever? I mean, there's so many things. So if you want to share in the venting, by all means, reach out to us on our social media platforms. Okay, on to our hot topic where we take turns finding a bizarre story and spring it on each other for reaction. It is your turn to spring something on me this episode, Miss Anita. What have you got?
Okay, so here's a bizarre one. Back in medieval times, the best disputes were settled with a sword fight. Apparently, a 40-year-old man from Kansas believes that's still a good idea in order to settle a dispute with his ex-wife.
Oh, God.
According to the Des Moines Register, David Ostrom has asked an Iowa judge to allow him to have a trial by combat in order to have a sword fight with his ex-wife, Bridget Ostrom, and her attorney, Matthew Hudson.
He wants to sword fight them both?
I don't know. David Ostrom claims his ex-wife and her lawyer, yep, I guess you're right, have legally destroyed him according to court documents. The man requested that court grant him 12 weeks to find katana and wakizashi swords for the duel.
What?
David Ostrom told the court, to this day, trial by combat has never been explicitly banned or restricted in the United States. They have been disputing in court over visitation and custody rights and payment of property taxes. Hudson asked court to suspend David Ostrom's current visitation rights in order for him to undergo a psychological evaluation.
You think?
On Monday, Judge, I'm just going to say D because I can't pronounce his last name, stated he won't have a decision on the matter anytime soon due to irregularities in motions and responses from both sides.
Like, does he even have to consider it? Like, he's actually considering it?
I guess because there actually is no law in place for this. How crazy is that?
That will, with all due respect to our American friends, they have some pretty bizarre laws still on the books, right?
True that.
So, you know what I would like to see? If he really wants to do something like that, you know when they get in the big air bubble suits? And they go on a log? Like, I can see that, but obviously not like weapons training.
Oh my gosh, isn't that crazy?
Well, I'm presuming the right thing will be done. And obviously the man even to consider it, you know, maybe is a little unstable. So
no kidding.
Wow. Okay. Well, if you want to join us in anything you've heard so far, have an idea for a hot topic or a guest you'd like us to talk to, Anita, where can they find us?
Oh, we can be found on Facebook. You can find us on Instagram. And of course, we have our website and Twitter as well.
That's cool. Yeah, we are Moms Sipping Sangria.
So, Sheila, we've come to the point in our podcast where we have to go to confession. And I believe that it's your turn.
Mine is actually more of a revelation.
Oh, okay.
If that's okay. So, you know, we are now in mid-February, and a lot of people made New Year's resolutions back in January. And, you know, we know a lot of people who make resolutions to get in shape. And I know a lot of women who are like, okay, we got to lose weight. This is going to make me feel really good and blah, blah, blah. So I was on that crazy treadmill for years and years and years, right? I started my first diet, I think, when I was about 13, right? And that's
similar. Yeah.
And I was never feeling that I had the right shape, the right, you know, the right weight, et cetera, et cetera. Mm-hmm. Looking back, of course, you're like, it was a skinny little thing. What was I? But, you know, at the time, your mind tells you differently. So fast forward into my mid to late 20s. And I ended up getting a stomach parasite. Do you remember? I think that's when I first
remember
met
that
you.
actually.
And it was called H. pylori. And what it does is it jumps into your intestines. It eats away your stomach. And it took the doctors a long time to figure out what I had. I would eat something, it would hit my stomach, and I would keel over in pain. It was so painful. So you can imagine I was on basically a liquid diet. I could have cream of wheat. I could have chicken broth, and I think I could have Jell-O. So those three things I don't eat anymore.
My God.
But that's all I could have. So I ended up dropping, I don't know, like 40 pounds. And I became this really skinny gal.
I remember you could even see like your collarbone, like everything was showing.
Right? Collarbones, hip bones were sticking out. So if I ever wanted to be skinny, careful what you wish for. And my body was in starvation mode. My BMI was dangerously low, and my stomach lining was gone, right? So I'm painting a picture of how skinny I was, because I know you know.
Oh, yeah.
So someone had suggested, why don't you turn lemons into lemonade? And there's a modeling agency. You might as well take advantage of this. So I did. And I went in, and you really do feel like a piece of meat. And they assessed me, and they're like, yeah, you know what? We could use you, but you're going to have to lose 10 pounds.
Are you kidding?
I swear to God.
Oh my gosh. You were so skinny, Sheila, at that time.
I know. So the revelation was
dangerously low.
Dangerously low. So I'm in starvation mode. I have bones sticking out, and I had to lose 10 pounds to model. So right then and there, Anita, I was so glad that happened to me, because the revelation was you're never going to be skinny enough for some people.
Right.
And it broke that cycle. And I tell that to so many people because I just think we're always trying to get somewhere until we're, okay, now I'm fine with myself. And it doesn't.
And we always disappoint ourselves,
right? We always disappoint ourselves.
Yeah.
So the revelation is, it was a great thing for me. And, I've gone up and I've gone down over the years, but I've always remembered that it's how I feel, not how other people perceive me. So that's my revelation. And I just think people who are, maybe you fell off the wagon already since New Year's resolution and you're already disappointing yourself. You know what? Just feel good. Do all the stuff, exercise, eat healthy, eat in moderation, enjoy life. But don't try to get to some stupid standard, because it's still not going to be good enough for somebody.
Right. And as long as you're feeling healthy, right? That's the important thing. If you're on the heavy side, then that's okay as long as you're feeling healthy. If you're not healthy, then you might have to take care of it a little bit. But that's crazy that they asked you to lose even more weight. I don't know where you would have lost it from.
Well, I mean, and I remember they were saying like Cindy Crawford is a curvy model. I'm like, what?
Yeah, really.
Who are
in
these
whose
people?
World, eh?
Right. So yeah, like it was a really good thing for me. And it was a real life lesson. And, being a mom of two daughters, I have always remembered that and never ever make food or a certain body standard an issue. It's just what you said. It's all about feeling great and exercising and eating well, and you are who you are. And that's an important lesson, and I hope everybody listening really takes that to heart. Okay, so before we wrap up here, we once again want to thank you for making time for us. As we say each and every episode, we know as busy moms and people who do multitasking, life is busy and very noisy, and we know it's tough to carve out time for anything. So we really appreciate you hanging out with us.
Okay, so before we go, we have a quote that we want to share. I'm going to tell you a quote, Sheila, and then you're going to try and guess who this is from. So, I'd walk through fire for my daughter. Well, not fire, because it's dangerous, but a super humid room, but not too humid, because my hair.
Oh my God. Cardi B. You know what? The first person it strikes me as is like something Ellen would say, but I know she doesn't have a daughter, so I don't know who.
Ryan Reynolds.
Ryan Reynolds. Yeah. Oh my God.
My namesake. He's a hottie.
He is. Funny. I automatically gravitated toward a woman.
Yeah,
that's so funny. Oh, that's good. That's really good. Okay, we're going to go have some sangria. Until next time, have a good one.
Have a good one. Don't forget to check us out on Facebook and like us on Instagram.
We are Moms Sipping Sangria. Time for the bloopers.
You're supposed to start, aren't you?
No.
Oh, I always go past it right at drives Ian crazy. Okay. All right, here we go.
You're really good at this. You're so concise and you have a lovely voice. I think if medicine doesn't work out. For sponsorship opportunities, email us at momssippingsangria@gmail.com. Mom Sipping Sangria is produced by Elm Podcasting.
Cha-cha-cha.
Keep going.
Woohoo. Okay. Hello.
Yeah.